Hello future nurses, and welcome to this session we're creating just for you. Today we're going to be going over how to administer an intramuscular injection or a vaccine. We are going over this because we want to make sure that you feel comfortable when you begin giving intramuscular vaccines, as well as we want to make sure that you are protecting yourself and you are protecting the patient which you're giving the vaccine to. We're going to go over the parts that we're going to need, or the supplies that we're going to need for the injections. We're going to go over what injections might be used for. We're going to see what are the parts of the syringe and the needle, because we want to make sure that we're familiar with those. And then we're going to go over how to verify that you have the correct medication or the right patient, the technique, how to dispose of the supplies, and then possible complications that we can have after you give the injection. So the parts of the syringe are as follows. According to the Eshelman School of Pharmacy, this was said in 2017, the basic parts are the barrel. So the barrel is this part here. It's the one that has the numbers, and it has lines here so you can be able to measure how much liquid you're going to put in here. Then you also have the plunger, which goes inside of the barrel, and this one pushes the medication or the injection, immunization out. And then you also have the tip. So the tip is the one that you screw the needle inside of. So the needle is this other part. So this one has a safety mechanism. So this is the needle here. So the needle has the part that you put into the syringe, and then it has a hollow tip at the end, and it's like slanted so that it's sharp and it's easier to inject into the patient, trying to prevent the pain for the patient. And then also it has a hole at the end, so this is how the solution comes out and administers it to the patient. So the intramuscular injections, we use them to administer either injections or vaccines. Injections can be medication that is ordered by the doctor. The main areas that we go for are, it's intramuscular, so it's in the muscle. So the main areas that we use for injections or vaccines that are intramuscular are the deltoid, which is the upper part of the arm, and it's like almost to the shoulder. So this has a good amount of muscle underneath. And then also the gluteus. So the gluteus, also known as the buttocks, that has one of the largest muscles in the body, so it helps to evenly distribute the medication or the vaccine throughout the body because of the absorption. For kids, we also administer the injection in the thigh. So it's like, so the thigh, kind of the middle part of the thigh, and then kind of to the right. So this is where there's another muscle, and that one is good for children, usually below the age of like 2. So some things that you need to make sure that you do check are that you have the right, not only the right materials, but you also have the right patient, you have the right medication, it's the right time to give it, it's the right dose. And then you have to have the right documentation saying that you administered what medication it is that you gave. That way you can properly know that everything was checked off and that you're good to go. So once you verify that you have the correct patient, the right medication, the dose is okay, the time is okay, then you're going to go ahead and assemble things together. So what you're going to need is you're going to need gloves. You're going to need the syringe and the needle, 2 alcohol swabs, a Band-Aid, a cotton ball, and then this would be your medication. So today we're just using like a generic bottle so we can be able to do it. So what you're going to do is you're going to put the syringe and the needle together just by twisting into the syringe. So then from your medication, you're going to remove the top. It's kind of like a protective top you remove it, and then it has like a rubber area right here. So with one of your cotton swabs, you're gonna clean to make sure that there's no dust or anything in there. And then with your syringe, you're gonna put it into the rubber, and then you're gonna pull on the plunger to get the appropriate amount. So today, let's say we're doing 0.5 milliliter. So you're gonna measure it by seeing the plunger, the black part of the plunger where it stops there, and that's at the 1/2. Then you remove it, and then we're gonna set this aside. I'm not supposed to recap, but I'm just gonna put this aside so I can show you. We have to also have the Band-Aid ready, so we're gonna open this up. We have to have the alcohol swab ready because we have to clean the patient, and the cotton ball. I usually put these together. So I don't have a patient to administer this for. So before you do put the gloves on, you're supposed to make sure that you wash your hands thoroughly, or you can use hand sanitizer. So you would rub it all over your hands until it's dry, and that's good enough. So you have your gloves on. I like to put the Band-Aid, I open it, and I like to put it here, like just the edge of it, so that when I finish administering the injection, I'm able to take it out, flip the safety mechanism, put the Band-Aid on, and then that way you don't have to be, opening the Band-Aid as you go. So if my patient were to be standing here, we're doing the arm, so let's do it on my arm for now. I'm not gonna inject myself. So then I'm gonna go ahead and do like a circle going outward to clean. You have to allow this to dry a little bit, and then you uncap it. So you're gonna inject, and once you're all the way inside, so let's say this is the skin, so it's all the way inside, and then you're gonna go ahead and push on the plunger, and then when you push, well, you're gonna see the solution here, but I don't know if you can see it. But anyways, the solution is coming out. And then once you're done administering it, you have to make sure that you flip. So this is the safety, so then it can't poke you anymore, because you want to make sure you protect yourself too. And then once you already gave that, you can put the cotton ball at the site, put a little bit of pressure just to make sure that the solution is staying inside of the muscle, and then you put the Band-Aid. There's no need to rub the muscle, because then you're gonna mess up the whole process of the absorption. So we want to make sure that we just put a little bit of pressure with the cotton swab and then put the Band-Aid on. So some complications can be that there could be redness or some type of a sign of infection. For that, we always ask the patients to come back. These things you can dispose of in the trash. Everything except for this, which is glass, and this, which is a needle. These go in the sharps container, which are going to be supplied to you by the place that you're going to be working at. We want to make sure that you document the patient's name, the medication, what route you gave, which would be intramuscular, how much you gave, and then how the patient tolerated the procedure. And then I just wanted to let you know that there are more resources that you can find on the website for the Center for Disease Control. They're located at www.cdc.gov, and I hope that this presentation has been helpful to you and that you will be able to utilize it in your upcoming careers as nurses. Thank you so much.